If we're going to build a new model for illegal drugs that is actually responsive to evidence, we need to learn the lessons from alcohol and tobacco. And the language on here is your world to a ticket of sophistication and style. And she is using a drug that when used as directed will kill you. When we base our processes, our policies, and our laws on fantasy, we do not have very good outcomes for us as a whole society. We need evidence-based policies for drugs and alcohol and tobacco in our society. So that brings us to the place of the discussion of a regulated market for all currently illegal drugs. Let's go there. The foundation for the new model will be two things. It will be public health and human rights. It has advantages. It's global in its perspective and acceptance, and it has successfully empowered many marginalized groups and has a significant history in Canada as we support our own Charter of Rights and Freedoms. I don't mind saying that the human rights model has two weaknesses. First of all, it doesn't balance individual rights with individual responsibilities. And individuals need to be held accountable for their behavior, especially when we're talking about drugs. It also does not deal with health issues directly. That's why we need public health. Public health has advantages. It includes prevention, treatment, and education. It's accountable. It's goal-oriented. It specifies specific health approaches and interventions. It understands the issue of social cohesion. The connectedness of people in society has something to do with the health of all of our society. So the inclusion of people that are marginalized is absolutely woven into the public health theory. The weakness of public health is that it can be seen as too intrusive or controlling. That's why we need human rights. The health model brings the focus of population health, and the human rights model brings the user's perspective to the table. It is difficult to get the balance between public health and human rights. We need more public health with alcohol controls. We need more public health with tobacco controls. We need more human rights with medical marijuana program. Users were not included in the process when that program was developed by Health Canada. Our methadone programs are in need of more human rights. People on those programs can't travel. They get very locked into locations. That's a lack of human rights. So what public health tools could we actually use to regulate the market for currently illegal drugs? Tool number one for me is branding. If you allow branding to occur, marketing will occur. We've learned that lesson from tobacco. So what I have here, this is pre-branded pot. It's colorful, it's logoized, it's convenient, and it looks a whole lot like another product that we're only too familiar with. That would be a problem for us. The image on the right is non-branded cannabis. And it looks a whole lot like a medication. Very different images, and they take us to a different place in society. We can control the design of the packaging. We can control the amount per package, the formulation, and the concentration of the product. We can do huge warning labels. We can do registration and approval of products before they're allowed, and we can do package ingredient labeling. We would need to control the corporations. Corporations are legally required to meet the needs of their shareholders. Corporations are all about profit. If profit drives the new model, we have a problem. Health has to drive the new model, health and human rights. So we would need to do price control and profit control. We could have sales from government-run outlets only. Governments could be responsible for packaging. A percentage of the tax or profit could be allocated to prevention and treatment programs. I would suggest perhaps 100%. We could have a ban of public trading of stocks for companies that sell these products, so they wouldn't be able to come back to us and say, our shareholders tell us that we have to do this. We could prohibit advertising and marketing. We would need to be very thoughtful about the supplier, because right now suppliers range from whole communities in British Columbia to inner city gangs, to impoverished farmers in third world countries. And we would need to be very, very thoughtful about how we are going to include those folks in the new model. At the end of alcohol prohibition, the illegal alcohol suppliers participated in the new model and were allowed to become non-criminal. So we would need to work with that process to allow folks to exit the criminal lifestyle and start to participate in mainstream society. And we would also need to be very thoughtful about how we dealt with third world farmers. Quite honestly, the best argument for continuing drug prohibition that I've ever heard is that drug prohibition is the only counterbalancing force that prevents first world countries from completely sucking money out of third world countries, as it allows money to go back to those most impoverished countries on the planet. So we would have to be very thoughtful if we changed it in allowing third world farmers to be supported by this process. The organization that I'm aware of that does the best job of that is called Fair Trade. If I look at the actual regulatory techniques that we could use which would control who is allowed to purchase the drug, we could restrict based on degree of intoxication. We already do that. We have a liquor store policy in the province of British Columbia that says if you're really intoxicated, you can't buy alcohol. We could have proof of residency, and it could be by neighborhood, by city, by province, or quite frankly, by the country. We could have use location restrictions. We already have that. It's called bars for beer and wine. It's called people that smoke out in alleyways in the rain. It's called our supervised injection site for heroin and cocaine. So where the drug can be consumed can be regulated. We could have required training prior to purchase. If you want to purchase a firearm legally in this province, you need to go through a weekend training course. Perhaps people would need to pass a test prior to purchase, where you demonstrate that you have certain knowledge. We could have required membership in a group prior to purchase. Any professional group, be it physicians, accountants, veterinarians, nurses, belong to a professional body that dictates the behavior of that profession. That process of shared responsibility is a tool of cohesion. When people are responsible for each other's behavior, they get bounded together more tightly. We could do the same with drug users. What we could say is, if you want to purchase the drug, you need to be a member of a drug users group, and that group is then partially responsible, not fully responsible, but partially responsible for the behavior of the members of the group. And that group would do peer outreach and training and best practice policies in exactly the same way we regulate and control professionals. We also know that there are other needs other than dependency. The need that I've talked about elsewhere in this program is that any Aboriginal group that has had access to hallucinogenic drugs in their flora around them since the beginning of time have used those drugs according to ancient religious and spiritual traditions. So perhaps proof of need would be defined as cultural need as well. Or perhaps an individual could put a stop purchase order on themselves where they'll be refused the product for a certain period of time. We already have that. If you are a gambler and you believe your gambling is out of control, you can have your photograph put up in the walls or the door of a gambling establishment, and you will be refused entry. I am not suggesting we make all of these changes at once. What I'm suggesting is incremental change. Incremental change that allows for data collection and then responding to the evidence. What a concept. Evidence-based policies. And sharing information with a very scared public. And a slow phasing in while the illegal market is monitored. And the changes can stop when we've got the illegal market to be as small as we would like it to be. How we would define success would be access to youth should go down in the new model. Health and social problems should go down in the new model, and crime should go down dramatically in the new model. What could we base the increments on? Well, drug type. Cannabis has the most popular support. Personally, I think we should start with the smokable injectable stimulants because they are the cause of most of our social and health problems associated with drugs. We could incrementally change the preparation. We know that a weak oral solution of cocaine, people who drink coca tea in South America have no problems with that. There are no social problems, health problems, economic problems associated with a weak oral solution of cocaine. A strong concentrated, smokable and injectable concentrations of it are more problematic. So we could start with preparations that we know are not harmful and slowly increase that incrementally. We could start with the cost of drugs. They could be more expensive and slowly make them cheaper. We could incrementally change the order delivery delay time. We could have a 24-hour delay between order and delivery. And we could make that a 23-hour and a 22-hour and a 12-hour and a 6-hour between the time that you ordered and the time the drug is actually delivered. That would prevent out-of-control sequential use. Where possible, we would change from administrative to social controls, because those are the tools that have been actually used by society since the beginning of time. We need to come up with the different regulatory options and match them to the individual drugs in a way that was based on evidence. What this slide says is there are 4 different relationships we can have with substances. We can become dependent on them. So we get sick when we are sick when we stop taking them. We can have a problematic relationship with drugs. It's causing problems in our lives, but when we stop taking them, we don't get sick. We can have a non-problematic relationship with drugs, which means it's not doing us any benefit, but it's also not doing us any harm. And we can also have a beneficial relationship with substances where we are healthier, we are better parents, we are more functional in our lives from our relationship with substances. The goal of a new paradigm would be to reduce the dependent and problematic relationships that people have with drugs in our society, and even to increase the beneficial options that drugs offer us. And one of my fascinations is a cross-cultural historical analysis of drug use. And what I observe is that any community from the beginning of time, from the beginning of recorded human history, that has had a benign relationship with a drug tends to use not what I've just talked about. They tend to use social controls, not administrative controls. So in understanding how societies function with drugs in a way that does not produce harm, we have to look at other techniques as well. Social controls break down into 3 categories. There are social norms, things like coffee breaks and wine only with food and not drinking alcohol with breakfast. There are social rituals where the behavior during the use of the drug is prescribed. Japanese tea ceremonies and cocoa leaf rituals are examples. And then if there's a spiritual component on top of that, it becomes a sacred ritual. And 2 examples of that are peyote rituals and ayahuasca rituals. Social controls function to increase social bonding. As I said, I'm a social worker, and my interest is in how our society as a whole functions. Drug prohibition targets individuals and marginalizes them. These are the techniques of social connection between people. My conclusion: we need evidence-based drug policies that are based in both human rights and public health. This is supported by both sound economics and compassion. We can no longer afford to participate in the fantasy that the war on drugs, that drug prohibition, is doing us any good at all. Would drug use go up in the new system? There's 2 types of drug use. There's drug use and there's drug abuse. People who abuse drugs are often people that have significant other social and health problems. And they're already abusing drugs. Drug addiction is not solely associated with drugs. Drug addiction is a complex societal, individual, family health problem. It already exists. Those folks will still be a problem. They won't go away. But what we can do is reduce the problem by regulating and controlling these drugs in our society so the damage goes down for all of us.